to echo your point, it's an easy treatment, really, as long as it gets diagnosed.
Yes, exactly.
So really kudos to you, sir, on kind of building. Sir, switching gears a little bit in terms of your, founder journey. As a venture capitalist and, private equity investor, I've seen a lot of founders build in software, in AI. What convinced you, really, in building a hardware-driven biotech company here in India? Or what inspired you?
I think the big gap still is hardware.
Sure, sir.
Right? AI will come always on top of it. Even in TB, AI does play a role, especially in terms of X-rays, which can be interpreted through AI and so on, but not without an hardware. So you still need a hardware. In the X-ray, you still need the X-ray machine, and the X-ray images are read by AI. In our own case in TrueNat, although AI doesn't play a direct role, but AI does play a role in terms of integrating all the information and providing a common platform to be able to monitor patients on a long term. So hardware is number one, and the AI comes on top of that. So AI by itself cannot do much in the healthcare space, at least. So that's where we are. So somebody has to do the hardware part, and so that's where we thought we should come in the picture, because definitely there were a lot of issues and required innovations to solve them, and so we thought we should be playing that role, and that's.
I think so, very well said. Thinking of kind of hardware and where you're at, how do you think that point of care molecular diagnostics will evolve over the next decade?
So TB is an example, but people suffer from multiple diseases, right? And infectious diseases. And all of them are killers in some way or the other, whether it's dengue, whether it's typhoid, whether it is malaria, all of them are killers, and all of them need early diagnosis. So the beauty of the platform like TrueNat that we have, although we are putting it for TB diagnosis right now, but the same machine can do 40 different diseases now. So right at the community level, right at the primary level, people can now look for 40 different conditions. And all these diseases now can be diagnosed early, and people can be put on right treatment. So first of all, it helps the patient because the patient survives, because he got diagnosed early and he got the right treatment. But it also ensures that he stops transmitting to other people, so that you also cut down the transmission of the diseases. And at the same time, these people don't go to now tertiary centers, so the cost of treatment on these patients, which we are all spending huge amounts of money on, doesn't have to happen because people are getting diagnosed early and treated.
That's very, so if I can dive a little more into what you just said, that, one of the most powerful aspect of Molbio's work is that technology, to your point, reaches small towns and rural health centers. As a founder, how does it really feel to see this high-tech innovation directly impacting lives on ground and in small rural parts of, India and creating impact?
No, that's what motivates me, and that's what keeps me driven all the time. I absolutely feel so satisfied for all the work that we did. It took us about 14 years to get this technology to the market. But now I'm seeing that we are saving thousands of lives. That's what makes me sleep peacefully, and that's what makes me get up with a lot of excitement in the morning. And every day is a new day, and every day keep looking for what we can do to make things even better.
So that's such an inspiring, line. My mom often tells me that, do things that make you sleep well at night and that make you jump off the bed next morning. And I think you echo that. So switching gears a little bit, India is increasingly becoming a hub for biotechnology innovation. As someone who's seen, all ends of the spectrum, what structural changes have enabled this? And what more still needs to happen?
So yes, there's a lot of momentum now. So especially post-COVID, a lot of startup companies have realized that they can actually do a lot more than what they thought they could do earlier. So they're all coming up and trying to do a lot of innovations from their side. Plus, the government is also recognizing the startup culture and the need for startups to be enabled. So there is a lot of schemes and a lot of money now getting available for these startup companies to move forward. Earlier, that was a major bottleneck. So things are looking quite positive. Only thing that can improve now is all these efforts must be more consolidated and more focused, because every department I can see is acting in silos. They're all doing their own small bits here and there, but that doesn't really, that doesn't really create that kind of an impact. So I think all these efforts have to come together, and we have to work with one common vision and ensure that these startups are taken to the right level. That is a major gap. So that's why you see a lot of startups are also closing down nowadays, but it's very unfortunate, just because they're not getting the ecosystem and the support function. And another problem in India is also, innovation has never been our culture, right?
Yes, sir.
We have never been taught to innovate from the beginning, and to fail is punished.
Yes, sir.
So people are afraid to fail. So that's the difference between the US, for example, and India.
Yes, sir.
That in the US, you can fail and you can start again, and you still get supported. You still have people backing you up. But in India, once you fail, that's the end of it. I mean, you're completely finished. And that's a problem. So that mindset and that ecosystem has to change. There has to be more enablement, and people should be made to innovate freely and not worry about, getting wiped out completely.
So if on that exact note, two questions for you. Looking back as a founder, what has been the most difficult decision that you've made? And second, what is really your message for budding entrepreneurs, who are maybe currently in a lab or in an incubator trying to build the next Molbio?
So innovation comes with a lot of sacrifice and commitments that you have to make. So you have to be prepared well in the beginning that it is going to be a hard journey, it is going to be a long journey. You must have that conviction and that kind of commitment to take this through till the end. You will have to go through a lot of hurdles. Many times, as we call them, you will encounter valleys of death. But you should know how to come out of those valleys of death. That is where you become different. So in my own case, I can say that we really had many valleys of death, and many times we started questioning ourselves. Are we really doing the right thing? Is this what the world wants? But we had that conviction that yes, this is what the world wants. We must do it. We must keep going. So against all negativity around, we still continued, went on, and that's how it works. So people should be prepared for it. In our case, we didn't have so much of a supporting ecosystem, but today ecosystems are getting better. So I think startups have a good time, and they just have to ensure that they know what they want to do. They clearly define the impact that they're going to create and just keep doing it. That's all.
Well, sir, on that note, thank you very much for joining me this afternoon, and such a pleasure. Keep doing the good work and inspiring many around. Thank you very much, sir.
Thank you very much. Thank you.
Well, that was, yes, indeed, a very, thought-provoking session. Some sessions, of course, do lead you to think and, of course, hopefully take some of those ideas forward and imbibe them as well. All right, well, now, coming up on stage, we have a special keynote address. We are, of course, switching our segment. We are going to be now focusing on next in global foresight. And to delve more on the global foresight, and in particular on the freedom of action, the building of strategic opportunity in a disrupted world that we live in. We're going to be hearing from the senior partner of Kearney Foresight and global head of the National Transformational Institute, Mr. Rudolf Lomea III. Could we please have you on stage, sir? Let's keep the applause going. Let's get the energy up in the room. And over to you. Thank you.